Welcome to Doc Vat's channel. Here we break down nice guidelines on all sorts of health topics, and today we're going to deep dive into asthma diagnoses.
Sounds good.
Specifically what the nice guidelines say about how doctors go about figuring out if someone might have asthma.
Yeah, so it really is, it's a bit like detective work. There's no one magic test. It's more like piecing together clues
Right.
from symptoms and family history and a whole bunch of different tests to kind of get that full picture.
Okay, so let's imagine I walk into the doctor's office and I'm like, I think I might have asthma.
Okay.
What are some of the first things they're going to want to ask me about?
Well, they'll want to hear all about your symptoms.
Right.
Especially those classic ones we think about with asthma. So wheezing, coughing, shortness of breath, and any chest tightness you might be experiencing.
Right, like all those things that make you think, maybe this isn't just a regular cold.
Exactly.
Yeah.
And, it's more than just having those symptoms, right? It's about the pattern of those symptoms.
Okay.
So asthma symptoms tend to come and go.
So you might be fine for a while and then bam,
Exactly.
out of nowhere, wheezing.
Yeah.
So what kind of things trigger those sudden flare-ups?
Yeah. So common triggers are things like exercise. So maybe you get it after running for the bus.
Okay.
Allergens, things like pollen or dust mites or pet dander.
Right.
Cold air, or, even viral infections can trigger those symptoms as well.
Okay.
And one thing that the guidelines highlight that I think is interesting is that for adults,
Yeah.
certain medications can sometimes trigger asthma symptoms as well,
Oh, really?
like NSAIDs, things like ibuprofen, or even beta blockers, which are used for a variety of different conditions. So it just shows you how interconnected our health can be.
Wow. I never even thought about medications as a potential trigger for asthma symptoms.
Yeah.
So much for popping ibuprofen when I overdo it at the gym.
You're right. Exactly.
But okay, say I tell my doctor all about my symptoms and when they happen,
yeah.
what else are they going to be looking for?
Well, they'll definitely be asking about your family history.
Okay.
So if your parents or siblings have asthma, or even other allergies like eczema or hay fever, that actually increases your chances of having asthma as well.
Okay, so it's not just grandma being like, oh, my bad knees.
Exactly.
I got it from my great aunt so-and-so.
Exactly. And it's not just anecdotal, right?
Right.
There's actually research that's found specific genes that are linked to asthma.
Oh, wow.
There are variations in the gene for a protein called
I'm not even going to try and say that.
but it's,
Bonnie.
it's involved in the immune response, and those variations can make you more susceptible.
Okay.
So family history can be a really big clue.
So it's really looking at all those factors. But say my family's healthy as horses.
Okay.
Does that mean I'm totally off the hook?
Not necessarily. It's just one piece of the puzzle, right? While family history is important, doctors also use objective tests to actually see what's happening in your lungs.
Okay, so we're going to get into the nitty-gritty
Exactly.
of the actual science behind it.
Yeah, one of the main tests that they use is something called spirometry.
Okay, I've heard of this.
Yeah.
It's where you have to blow really hard into a tube or something.
Exactly.
It's kind of intense.
It can be a bit of a workout, but it gives us a lot of information.
Okay.
So basically what spirometry does is it measures how much air you can breathe in and out and how quickly you can do it. And that tells us if there's any blockage or narrowing in your airways.
Okay, so it's not just how you feel. It's actually measuring
Right.
what's going on in there.
Exactly. Quantifying it.
Yeah, what other tests are there? Because I'm starting to realize there's a lot that goes into this.
Yeah, there's a bunch of different tests. So another one is the FeNO test.
FeNO.
Yeah.
What is that?
So this one measures nitric oxide in your breath.
Like what's in car exhaust?
Yes,
Yeah.
exactly. Our bodies actually produce small amounts of nitric oxide naturally, but high levels in your breath can be a sign of inflammation in the airways, and that's a key feature of asthma.
Oh, that's fascinating.
Yeah.
Okay, what else?
So there's also something called peak flow variability,
Okay.
where you actually track how fast you can exhale over a few weeks
Why?
using a peak flow meter at home.
Okay.
And if your peak flow varies a lot from day to day, that can also be an indication of asthma.
So if I'm having a good day versus a bad day,
Exactly.
it's going to be very different.
Exactly.
Okay.
And then finally, there's the bronchodilator reversibility test, or BDR.
BDR. Okay.
And this one checks to see if your airways open up more after using an inhaler.
Okay.
which can be a good sign that it might be asthma.
Okay, so they're really trying to look at this from all these different angles.
Absolutely.
But what if the tests aren't totally clear or there's something else going on?
Right. So that's where doctors also look for what we call red flags.
Red flags, what are those?
So these are symptoms that might signal that something other than asthma is going on.
Oh, okay, that sounds serious.
Yeah. So in adults, some red flag symptoms would include things like fever, weight loss, chest pain, coughing up blood, or finger clubbing.
Finger clubbing, what is that?
Yeah, so that's when the fingertips actually widen and the nails curve downwards.
Yeah.
It can be a sign of long-term lung problems.
Okay, so that's definitely
Yeah, you want to get that checked out.
not something you want to ignore.
Exactly. And in children, the red flags are a bit different.
Oh,
Things like failure to thrive, difficulty feeding, and a persistent wet cough.
okay.
So if you're seeing any of these red flags, whether you're an adult or a child, it's crucial to get checked out by a doctor right away because it could be something more serious than asthma.
Okay, so I'm seeing this as pretty complex.
Yeah.
But all these tests you've mentioned seem geared towards adults.
Right.
What about diagnosing asthma in kids?
Yeah, that's a great question.
Especially really little ones.
That's definitely a challenge for doctors because it's harder to do those objective tests like spirometry on very young children.
I can imagine.
They don't have the same lung capacity, and they might not be able to follow instructions as well.
Right. They can't really tell you what's going on.
Exactly. So diagnosing asthma in those under 5 especially relies more on the symptoms, the history, and the family history.
So it's even more like detective work when it comes to those little guys.
Absolutely. Yeah, much more nuanced for sure.
Wow, this has been so insightful. I'm starting to really see how much goes into an asthma diagnosis.
Yeah.
But you know, with all the advancements in medicine these days, is there anything new on the horizon
Yeah.
for diagnosing asthma, especially those trickier cases with young kids?
There's definitely a lot of exciting research going on that could really change how we diagnose asthma, especially in younger patients.
Okay, now we're talking. So tell me about some of this cutting edge science.
Mm.
What's out there that can make diagnosing asthma easier and faster, especially for, little kids who, sometimes you can't even get them to sit still for 2 seconds.
Right, exactly. Well, one really promising area is the development of what we call breath-based biomarkers.
Breath-based biomarkers. So you mean like analyzing someone's breath to see if they have asthma?
Exactly. Yeah. So remember how we talked about the FeNO tests
Right.
measuring nitric oxide?
Mm.
Well, researchers are looking for other compounds in exhaled breath that might be even more specific indicators of asthma.
Okay.
So going beyond just inflammation.
So they're trying to pinpoint specific molecules that are basically like a flashing neon sign saying asthma's here.
Pretty much, yeah. And the technology to do this is getting really sophisticated.
Wow.
They're even developing handheld devices that could, potentially diagnose asthma right there in the doctor's office.
No more big clunky machines.
Exactly. That's amazing.
Especially for kids who might be scared of needles or other procedures.
Right.
Just breathe into a device and boom, you get answers.
That's a game changer. What about other non-invasive methods? Are there any cool imaging techniques on the horizon? Yeah, there are. So researchers are using techniques like optical coherence tomography, or OCT for short.
OCT, I've heard of that. Isn't that what they use for like eye exam?
That's right. It's been adapted for use in the lungs as well.
Oh, wow.
And it basically uses light waves to create these super detailed 3D images of the airway walls.
So doctors can actually see the thickness in the structure.
Exactly.
Instead of just seeing like, is there a blockage or not? You can see the inflammation and damage caused by asthma.
Yeah, it's like having a microscope for your lungs.
That is incredible.
Yeah.
Are there any other exciting technologies in the works? Everyone's always talking about artificial intelligence these days. Is AI playing a role in asthma diagnosis too?
Oh, absolutely. AI is revolutionizing pretty much every field, and healthcare is no exception.
Yeah, no kidding.
So researchers are developing AI algorithms that can analyze tons of data,
Okay.
from symptoms and medical history to genetics and environmental factors.
So it's like this super-powered risk calculator that can spot people who might develop asthma even before they have symptoms.
Exactly. And that's where early identification can be a real game changer.
Because you could start treatment earlier.
Exactly. You could potentially even prevent asthma from developing in some cases.
Wow.
Imagine being able to pinpoint those at high risk and then, take steps to minimize their exposure to triggers,
Right.
or even start preventative treatments before they ever have their first wheezing episode.
That sounds like the future of healthcare. Proactive and personalized. But with all this incredible research and technology, I have to wonder, are there any potential downsides or ethical considerations we should be thinking about?
Yeah, that's a really important point. While these advancements offer tremendous promise, we need to be mindful of the potential ethical implications as well.
Okay, so like what?
Well, one concern is the possibility of overdiagnosis.
Overdiagnosis, what do you mean by that?
So, if we lean too heavily on these advanced technologies and we start diagnosing asthma based on very subtle changes that might not even be causing noticeable symptoms, we
Okay.
could end up overtreating people.
Right. You don't want to be taking medicine if you don't need to.
Exactly. And that means potentially exposing them to medications they don't really need,
Right.
along with all the risks those medications might carry.
Right. You don't want to just slap a label on someone
Exactly.
and then treat them for something that might not even be bothering them.
Exactly. It's a delicate balance.
Right.
We need to make sure we're using these technologies thoughtfully and responsibly
Mm-hmm.
with the goal of genuinely improving people's lives, not just putting labels on them.
Absolutely. And I imagine another issue could be like access and equity,
Absolutely.
right? Because these new technologies can be expensive.
Yeah.
So how do we ensure that everyone has access to them, not just those who can afford it?
Right. That's a really important point. We need to make sure that no one is left behind when it comes to advances in healthcare.
Absolutely. Healthcare advancements should benefit everyone,
Exactly.
regardless of their background or, financial situation.
I completely agree.
So it sounds like there's a lot to consider as these new technologies become more available.
Yeah, definitely.
What would you say is the key takeaway for our listeners as they think about their own health or the health of their loved ones, especially with all these changes happening in asthma diagnosis?
Well, I think the most important thing to remember is that asthma diagnosis is a dynamic, evolving field. It's not just about listening to your chest with a stethoscope anymore.
So much more goes into it now.
Exactly.
But it sounds like it's really crucial for people to stay informed and be really engaged in their own healthcare.
Absolutely. As new technologies and research emerge, it's so important for patients to ask questions, advocate for themselves, and really be active participants in that diagnostic process.
And don't forget, even if you are diagnosed with asthma,
Right.
it's not a life sentence.
Exactly.
With the right treatment and management, people with asthma can live full and active lives, right?
Absolutely. And who knows what the future holds? We might even see personalized treatments tailored to your unique genetic and molecular profile.
Tailor-made asthma care. Now, that's something to get excited about. This has been an incredible deep dive into the world of asthma diagnosis. Any final thoughts for our listeners before we wrap things up?
I think the biggest takeaway for everyone listening is that knowledge really is power when it comes to your health.
That's true.
The more you understand about conditions like asthma, the better equipped you are to really work with your doctor and make informed decisions about your care.
Yeah, we've covered so much today, from the classic symptoms to, cutting-edge research. It's amazing how much is involved in diagnosing asthma properly.
It really is, and it's constantly evolving.
Yeah,
So staying curious and informed is key.
for sure, for sure. So for any of our listeners out there who are concerned about asthma, either for themselves or for their loved ones, what's the first step they should take?
Don't hesitate to reach out to your doctor. They can assess your individual situation, taking into account your symptoms, your family history, any other relevant factors, and from there they can guide you through the appropriate tests and discuss the best course of action.
And remember, early diagnosis and treatment are so important for effectively managing asthma and minimizing its impact on your life.
Absolutely. With the right approach, you can live a full and active life, even with asthma.
That's a great message to end on. So to wrap up our deep dive into asthma diagnosis, I want to thank you so much for sharing your incredible knowledge and insights.
It's been my pleasure.
And to all our listeners, thank you so much for joining us on this journey. We hope you found it informative and maybe even a little bit inspiring. Stay curious, stay informed, and take charge of your health.
Until next time, stay healthy and keep exploring.
And don't forget to subscribe to Doc Vat's channel for more deep dives into fascinating medical topics. We'll see you soon.